What is a coronavirus?
Coronavirus is a family of viruses that have a lot of different types of viruses in them. And there are a number of these types of viruses that all are described under the umbrella of what we call coronaviruses. Some of the viruses in this family cause really mild diseases like the common cold. Some of them can cause more serious diseases like we're seeing now coming out of China. But really a coronavirus is a broad term for a family of many different types of viruses.
So I saw with all of the news that's coming out, I saw something online the other day about it was like a disinfectant or something, and it had coronavirus on the label. That doesn't mean the coronavirus that's coming out of China. That just means generally it helps with that strain of illness.
That's right. The product that you may have seen at least is advertised as being able to handle or perhaps disinfect that family of viruses. It's important to note, though, that not every claim that's made by a manufacturer about the ability to disinfect is necessarily true. What we recommend is that the best way to keep yourself and your family safe is just to wash your hands really, really thoroughly with good old soap and water. That's really the best strategy.
Okay, so very similar to trying to avoid catching a cold or the flu.
Well, it's interesting you say that because the same things that will keep you safe this winter from the flu are the very same things that keep you safe from any number of other viruses. I want to be really clear right now at the top. There are no confirmed cases of this coronavirus in Maine,
right,
nor are there any individuals that we're even evaluating for this disease right now. Right now in Maine, where we are at this time of the year, the biggest threat out there from a viral standpoint is influenza, seasonal flu,
okay,
which affects many, many more people. And the best way to stay safe against that is to get your flu shot and really wash your hands thoroughly.
And so when we hear about the Colby College students that have been quarantined, it doesn't mean that they're sick. It just means that they've been to China and they just want to keep an eye and make sure that they haven't contracted the virus.
You know, that's a situation where out of an abundance of caution, Colby College decided to provide alternative housing. Again, this is a situation where not a single person in Maine right now is even being evaluated for this virus, let alone having had been confirmed to have it.
Okay. Excellent point. And certainly not trying to scare anyone with this interview. On the other side of that, and just trying to inform people so that maybe it's a little less scary. Because I think there's a panic going on. Let's talk a little bit about what's going on in China. Why, Dr. Shah, is this virus spreading so rapidly?
Well, a couple of things have changed in the past couple of months that have given us a lot more insight and information about this virus. What we know is that starting in early to middle December, there started becoming a series of individuals in the central Chinese city of Wuhan who had a pneumonia that wasn't really explained or diagnosed by any of the standard methods. Scientists in China started investigating this, and within a few weeks, not only had they determined that it was a new type of virus, they had actually sequenced all the DNA in that virus, all the RNA in that virus, all of that in a matter of weeks. That in and of itself is pretty remarkable from a scientific standpoint. As a result of having decoded all of the genetic material, the RNA in this virus, they've learned a lot about how it behaves. And what we've learned is that it spreads through the air, through coughing, through droplets, things of that nature, through sneezing. And as a result, when individuals are in tight conditions, in cities, things like that, it can spread pretty rapidly. Even though there are now several thousand cases of this virus in China, the vast majority of the cases that have occurred around the globe have been within China. There are cases outside of China across the globe in other countries, but they're pretty small in comparison to the number of cases within China.
And am I correct in saying that the people outside of China that have been infected are people who have traveled to China?
That's a great point. I'm really glad you mentioned that. You are absolutely correct. Right now, the vast majority of cases that have been diagnosed outside of China are from individuals who had visited there. Just to put the numbers in context, just to give you a sense of the scope, there are over 25,000 cases of this coronavirus circulating right now across the globe. Of those 25,000 or so, the number changes every couple of hours.
Right.
Of those 25,000 or so, all but about 300, maybe 400 by now, are within China. So outside of China, there's maybe only about 400 cases. And of those 400 cases, almost all of them are individuals who had traveled to China.
Okay.
There have been a couple of instances where individuals have contracted the virus from somebody else, but it's pretty rare at this point.
Okay. We're getting the fatality numbers obviously out of China, and they're frightening, but is the percentage as high as it seems, or how deadly is this virus?
Right now, in the early stage of an outbreak, one of the things that we're always trying to get our handle on is how severe is the situation? What are we really looking at? And based on what we know right now, the coronavirus is concerning. A lot of the individuals in China who have sadly passed away, we're starting to learn about what factors they may have had that led them to pass away. But what I really want to emphasize in this situation is that, as I mentioned earlier, seasonal influenza, the regular old flu, the thing that you get your flu shot for, every year in the United States takes the lives of tens of thousands of Americans. And so if there's something to be worried about right now, where we are in the United States, right now it's seasonal influenza and much less so the coronavirus.
Okay. And again, preventing the flu and preventing the coronavirus, very similar, washing your hands and covering your cough, things like that.
Exactly right. The very same thing, the very same steps that you can take to protect your family against the flu, like washing your hands, covering up when you cough, and of course getting your flu shot, are the very same things that protect you against a bunch of other viruses. Not just this coronavirus, but almost every other virus out there.
Okay. And when you have a virus, at what point is it time to seek medical help?
Well, what I recommend to folks is that it's time to call your doctor when you don't think you're getting any better. If you're feeling down, but it feels like something you've had every year, and it's just the kind of thing you get in the winter, and before you know it, you take a nap and you wake up and you're feeling better, that's a good sign.
Okay.
But if you're not feeling well and you're not seeing yourself get any better, that's a sign that you need to give your doctor's office a call. They can evaluate you. They can come in, make sure you get checked out for all types of viruses, the most common of which is influenza.
Right.
Again, I just want to emphasize that according to the Maine CDC, as well as the U.S. federal CDC, the risk of this coronavirus for anybody in the United States and anybody in Maine is very low right now.
Right. And again, there are no cases in Maine.
That is correct. There are no cases in Maine, and we're not even evaluating anybody. But it is important to know what's going on, and so I'm glad we're able to chat because having the facts are important. One of the things that we're seeing across the globe right now is in any type of situation where there's something new going on, something that sounds a little bit scary. It's not long after that before information that's not 100% accurate starts spreading.
Right.
And so I want to make sure that everyone's got the facts. And right now the facts are that although this is concerning, many of the cases the vast majority of cases have been confined to China. The cases that are outside of China are in folks who had traveled there. And as a result of that, the overall risk to anybody in the United States, especially here in Maine, is low.
Okay. Wonderful. Is there a place, Dr. Shah, where people can get more information about the coronavirus? Is there information on the CDC website?
There absolutely is. I'm glad you asked. We at the Maine CDC have stood up a website that provides the facts about what's going on, what we're doing, what we know, and anyone can get to that from our website, the mainecdc.website. You can also go to the U.S. CDC's website, which is updated very frequently, as is ours, to get the latest information, again, about what we know about this virus, what we're doing about it, and what you can do to keep you and your family safe.
Well, that's what I had, Dr. Shah. Did we miss anything? Is there anything that you wanted to add?
No, I'm really delighted to be able to share with everyone what the facts are. In addition to making sure that we've provided all the facts to folks, we are, of course, working with hospitals, healthcare providers, everybody out there to make sure that they are equipped and ready to evaluate any patient who comes in the door. So we are ready for this situation, and we're glad to be able to provide the facts to folks.